You're listening to Healthy Discussions, a podcast where we explore big ideas and questions with our guests. I'm Zach Hassan, a junior doctor from Scotland. If you're interested in finding open and rational conversations about society's issues, then this is the podcast for you. This week I'm talking with Dr. Devina Maru. Devina was one of the National Clinical Director's Medical Fellows for 2021 to 2022, and she's also a GP trainee. She's been involved in a variety of projects, ranging from policy to the NHS Clinical Entrepreneur programme. I hope you enjoy. Devina, welcome to the podcast.
Thank you for having me, Zach.
Oh, well, it's an absolute pleasure. And I have to say, when I was doing my background research for this episode, I was really amazed at just how much stuff you have managed to find time to do in your spare time. And I wonder, what was it that got you interested in doing some of these extra projects in the first place?
Well, I've always had an interest outside of just purely clinical medicine, specifically around health policy or leadership and management. And when I saw this opportunity within training to have this role as the National Medical Director's Clinical Fellow, I thought it was a really opportune moment to actually do some of these activities and contribute to national policies. So right now, I'm based at the Care Quality Commission, working around regulation, but I've also, like you mentioned, I do some work with the Department of Health and Social Care around physical activity, and then I have this interest around health inequalities and communities. Hence, I set up that charity and now part of the NHS Clinical Entrepreneur programme. But it was really nice to know that within medicine, there's loads of things that you can do, not just purely clinical, but each of these aspects contribute to the patient at the end of the day. It's just a different way of doing it. And policy is really important because that's what the guidelines that doctors follow. So that was my journey.
And was it something that you always wanted to get involved in, or was it something that you discovered along the way at medical school?
I think I discovered it during medical school. So I was always that trainee asking the registrar, probably being a bit annoying actually, saying, why are we following these nice guidelines? There's a actually more streamlined way of doing this. Or I was that trainee who said, actually, can I do a quick project because I can identify a more of efficient way of doing it? So that's when I started realising that I was actually more suited for a health policy or strategy role, because I thought in that sort of aspect or realm of medicine rather than sort of that clinical urgent care at that moment in time. So I was always told by my sort of programme tutors within med school, maybe actually you need to explore this, because if this is what you enjoy, we actually need people who need to be at the table in health policy making decisions. And what I've learned through this role is you can do things like that. So you identify inefficiencies, potential improvements for transformations, when looking at existing strategies. You can look at care pathway deliveries, how to streamline it. You give your clinical insight in advising new policy proposals. And that's basically health policy and what I enjoy. So I discovered myself probably within med school.
And my understanding of health policy is that, this is where some of the decisions are taken that really have high impact in terms of how the system works. So, something that I found as a junior doctor working on the hospital wards is that if there is an issue, you don't always have the power or the resources to be able to do something about it, especially if those policy decisions have already been made at a higher level. So something that I was wondering about is what kind of things are you involved with day to day? What is the work actually like, and how does it compare to your clinical work?
It's very true, because an understanding of the structure of the NHS is crucial to influencing health and social care. And what I've realized is that clinical knowledge alone the system can survive, but it may not thrive. And that's why health policy, I personally think, should be made a mandatory component of training. And it really urges clinicians to stop being at the periphery of these decisions, but rather at the table. And we have seen that health and social care has become so much more complex over the years, and we're noticing closer links with governments, international health organizations, academics. And COVID-19 really highlighted the importance of working together and how health policy was essential, because you rapidly had to make decisions so clinicians could follow guidelines of what to do in emergencies. So things that I've been doing in my fellowship is things like analysis of qualitative data and collection of reports, for example, for the Department of Health and Social Care, attending weekly meetings with policymakers in which you might see recent policy updates or debate it internally with your team. You might participate in focus interview groups with stakeholders, clinical directors, allied healthcare professionals. You provide clinical insight and you advise new policy proposals from your first-hand experience based on the needs of day-to-day practice. And as I mentioned earlier, you identify inefficiencies, improvements, transformation of existing strategies. But within this fellowship, I've been lucky to actually lead a project myself, and I'm specifically looking at the innovation that occurred across primary care over the years and how we can recognise that within regulatory processes and developing a resource for clinicians on the ground. So you can also be creative and start something from scratch. So there's loads of opportunity within the realm of health policy.
And that sounds like the project that you're doing now. It's really a chance for you to get to show what you can do. Like, you're being given some leeway to run with a project idea by yourself. So can you tell us a little bit more about how you settle on what problem it is you want to work on and kind of what your approach is? Because I think that'd be really helpful for early career clinicians that are listening to this and wanting to get involved in that kind of stuff.
So definitely you should always select a project that you're passionate about, because then it's going to be less of a chore when you do it. So I had that interest within innovation, obviously primary care, as I am a GP registrar. And then, as I mentioned before, I liked health inequalities in terms of trying to tackle the problem of it and finding solutions. So that project had combined my interests of innovation, primary care, and health inequalities. So number one thing is always pursue something you're passionate about, because then otherwise you're not going to even be interested or even bother to do anything about it. Then look at how it's currently running within, whether it's the NHS system and it's within the community, and identify potential ways to try and streamline those processes. Look at risks, mitigations. If you change something, think forward, what will be the outcome of it? And remember, we're just trying to simplify and streamline processes, but you have to remember at the end, your patient is the most important thing. So we need to make sure whatever you do is still safe.
So what kind of processes is it that you're looking at? What kind of things are you are easy things to focus on in terms of streamlining? Can you give us any examples?
Well, right now, we're looking at the regulatory processes of recognizing innovation within my project. So when inspectors go into GP practices, sometimes they feel some of their innovations are not recognized. Sometimes then they feel not valued, because what's the point of going the extra mile to help the communities and reducing health inequalities? So then you look at ways that inspectors can actually recognize it. So we are developing like this resource for providers that they can easily follow. So that's already streamlining, and not only streamlining, but standardizing the process. So whatever inspectors look at or whatever reports they have to submit, each region will be doing the same thing. So that's standardizing a process. And yeah, that's probably an example of streamlining. Well, there's an NHS backlog going on right now. Obviously, you've probably seen they're doing a lot of policy writing around how we can try and streamline that, as another example.
Yeah, and it seems to me that streamlining the processes in the NHS is going to be a big part of how we deal with that backlog. Being more efficient about it seems to me to be incredibly important. So it's good in a sense that you're actually in the room getting to make some of these decisions. Do you find that your clinical experience of what processes it is that you've had to go through, versus as a trainee foundation year doctor and then as a GP registrar, what does that clinical experience give you that means that you can add value in those policy discussions?
As a clinician, I understand what's happening on the ground, and sometimes we're always wondering, actually, are these policymakers, have they actually been a junior doctor before? It's tough work. Do they understand what we're doing? So I think I can provide that grassroots clinical insight from the ground. And it's really unfortunate that we know that clinicians are not typically exposed to health policy from the onset of their medical training. And only a minority of clinicians branch out into these roles into their mid to later stages of their training. But we have to realize that clinicians play a massive key role in these developments and transformation of the health sector. And despite medical school providing us with a strong foundation in clinical knowledge, it's only one pillar of this multifaceted NHS. And I feel the curriculum has distinct gaps in the parallel world of health policy, which really underpins our clinical practice because we are following health policy guidelines. And if, as a medical student, you appreciated the intricacies and the details of health policy, we will appreciate system redesign, reforms to tackle health inequalities and regulation. And it's time we demystify the complexities and layers of the NHS if we're taught it from the curriculum at the very beginning. Whether you go into it or not is your choice, but we should understand the structures of the NHS and why we follow these health policy guidelines.
Yeah, I mean, that seems to make complete sense to me. Sometimes one argument that I've encountered when I've kind of made similar points is that people have said things along the lines of, oh, well, doctors are just supposed to be doctors. They're just supposed to be working on the front line. They shouldn't busy themselves with these sort of larger questions. That's not really our job. It's not our skill set. But when I think about that, I kind of think, well, if you've got a whole bunch of medical students that are going to be the next generation of doctors, getting them informed about the way that these system and policy decisions are made, surely that's got to be really important in terms of how our health system develops, right?
Exactly.
And your work on the Big GP consultation has probably given you a lot of insight into what kind of changes, future direction you want to go in. So tell us a little bit about that project and what you've been learning from it.
So I completely honestly agree with you. I feel like as doctors, we're the first port of call for our patients, and therefore we are in that privileged position where we can be the advocates to drive change for them within our systems and local communities. And the reason I co-founded the Big GP Consultation Platform was because there's a huge reformation and transformation of primary care happening now. And Jeremy Hunt had this huge consultation out just recently, and I felt that the only people who would actually submit anything are going to be just organizations or people specifically involved in health policy. But I wanted to produce a collaborative, co-produced vision from grassroots actual doctors working on the ground. So I just set up this platform with a group of other fellows within my scheme. So we have GP trainees, foundation doctors interested in general practice, early career GPs, and we all come together on this platform and discuss various topics, whether it's sustainable healthcare, health inequalities, it could be integrated care systems, and we debate with each other about what the vision is. We have sort of questions we discuss, and then what we do is we produce a infographic and a collaborative co-produced report, and that the plan is then to present these to these organizations and say, this is what your current workforce actually sees as a vision. So that way it's not really biased to certain organisations, and that's why I think it's really essential that doctors on the ground right now have a say on our future, because we are the future healthcare workforce.
Yeah. I'd be really interested to know what kind of happens, what the next stage of that is, because it sounds like you're playing a really important role in gathering intelligence from the front line about what problems exist, what could be done about them. But then, who takes that information from you once you've made the infographic, and what can they do with it?
We're in the process of producing these infographics, and we've already released it from our first session, and then we did a summary report. And then at the end of the 6 sessions, or even sort of maybe in between, we are going to present it to these organisations. But what's really interesting is that we caught the attention of these organisations. They've actually come to us before we've come to them, from the likes of whether it's Health Education England, NHS England, and they've actually asked us to come and speak at their events. And then we can actually then work collaboratively together about how to move forward and how these changes can be incorporated in the policy that's currently writing. So they actually ended up coming to us.
Yeah. Well, it's good to be popular in that kind of way, isn't it? So I'm interested to know about how you balance the clinical side of things with the policy side of things. Because when you were a medical student, and it sounds like you were getting involved with the BMA at one point. Do you see all that as part of the same kind of process that you were getting involved in bigger things?
Yeah. So as a junior doctor, I was part of the BMA, and it was when you were the representative for the junior doctors. That was a glimpse into what you can do in a sort of leadership role to change things and be advocates for those junior doctors.
Yeah.
And when you see change, it's really satisfying. So I think, yes, that is a small step into sort of leadership and health policy. Well, BMA is obviously a trade union, but you can get involved in decisions like contracts or making sure everything is equal for junior doctors. So, yeah.
And do you like both these sort of activities equally, or do you feel like you're a clinician at heart, but this has been a nice thing to sort of do for a while, or is it too early to say yet?
Oh, I do like both. Like when I do health policy, let's say for a good few weeks, I miss seeing my patient. So I cannot let that go. And that's probably, at the end of the day, that's why I became a doctor, was to see patients and talk to them. And hence I also became a GP because I like getting to know them, that continuity. So I wouldn't be able to let one or the other go. I miss it too much. Yeah.
No, I'm totally with you on that as well. So I want us to sort of imagine that there's a medical student that wants to get involved in health policy, sees what you're doing, Devina, and thinks, wow, I'd like to do that too. What kind of opportunities are available for them to start getting involved in some of this stuff? If they're kind of thinking, oh, I might like to lead a project like that as well. That sounds cool.
So as a medical student, well, I'm currently in this fellowship. It's by the Faculty of Medical Leadership and Management, but I know that a few medical students do a little internship, or I don't know where it's called, elective. They spend a few weeks with these organisations. So do explore those opportunities, whether it's elective or internships. That was the issue, though. As a medical student, I feel they need to provide more opportunities. That's the whole point. We want to try and add it into the curriculum. I mean, as a junior doctor, we have posts like fellowships, and we have in GP, we have integrated training posts where you can do some clinical, but you can do a bit of health policy or combine it with medical education. So I feel like there's more opportunity as you have qualified, but there are some as a medical student, but I think more needs to be done.
Yeah. And what kind of skills is it that you think that medical students could be given? that would help them get involved, or is it just a case of giving them the time to work on a similar project, like you've suggested?
So the skills that I've actually obtained doing this health policy job is things like project management, working with people from strategy, legal, finance, and obtaining these skills that a clinician would normally not obtain from working in the medical environment. So you start learning how to do business case proposals, how to write reports, present at governance meetings, sitting at roundtable stakeholder meetings and leading or chairing it, writing agendas. So this was a different aspect that I had never really experienced in sort of medical school, working as a GP trainee. So those are the things that you get.
It sounds kind of exciting in a way, because that's so alien to what most doctors do, but it is actually how a lot of the business world works. It's how a lot of the public sector works. Is that sort of helped inform your ideas about the entrepreneurship side of things? I was wondering if you could tell us a little bit about what your involvement is in the clinical entrepreneurship program and what kind of things you're doing there.
Yeah, so I was the first medic in my family, so I was always surrounded by hearing non-medical things. So it came naturally to me to kind of wander off the path of medicine. And I enjoyed business and sort of the finance. One of my A levels was economics. So it really shows sort of that hybrid approach that I had. I like medicine, but I like business too. And hence I also went into primary care, because primary care in itself is a business and partners have to run the practice, etc. So I found that side really interesting. And when I initially, with another GP training colleague, set up a community initiative to help young people from socioeconomic deprived areas, and we were doing free health promotion lessons for them, teaching them about healthy eating, physical activity. Then we did some mentorship classes. But I used that sort of business skills that I had obtained over time to try and expand that. So I would help write the strategy for that. I would think about the marketing. And then actually, I embarked upon an MBA during the middle of this. I got my MBA, and that helped me develop it further. And then our community initiatives expanded into a charity incorporated organization, and now we cover the whole of London. Well, this year we're trying to nationalize now, and it only started from a small area in Tower Hamlets. So
wow.
Yeah, and then I applied to the Clinical Entrepreneur program this year to try and expand it, and that's why I've just started this year actually.
And what's the deal with the Clinical Entrepreneurship program? Why work with them rather than just keep doing your own thing, which it sounds like you're pretty good at doing, to be honest.
I think it's the network, the opportunities, and you learn tips from leaders who've been through expanding businesses, which I would never have those contacts within the medical world. And it's I think the most important part is the networking connections and trying to find ways to get funding, things like that. Yeah.
I see. So are there any tips that you'd like to share with us that you've learned about the business side of things? I'm just wondering if any listeners will have business ideas of their own. How can they get started or benefit from what you've learned from?
Well, definitely when you set up a business, I think the key thing is having a mission statement and a value statement. You need to really know what your goal and aim is for your program. And once you've written that down, you can start then writing on paper what your strategy is. Your strategy at the end of the day is your skeleton. And if you don't have anything and you're just flowing with it, it's going to get a bit messy and you'll come across many hurdles. So start with a good vision, a mission statement, and then start developing your skeleton, your strategy of where you're going to go. So that's where to start.
Okay. Do you think policymakers are doing enough to encourage clinicians to come and get involved in these sorts of things? or is it something that you're still having to very much forge your own path because you really want to get involved in it?
I think policymakers really value clinical insight, but it's just ensuring that there's enough clinicians who want to actually do that and walk into that sort of new area. But I do think they definitely value our clinical insight.
Yeah. Okay. So I'm just thinking about whether I normally finish the conversation by asking about if there's a book that you've read that touches on some of the ideas that we've been talking about. And if you could make a little suggestion of something that's had an impact on you.
I'll be honest, was the last time I read a book because I'm so busy.
Well, no, I can tell. I can tell with how much stuff you're doing. Something which I should have asked you though, which I didn't get a chance, was, what your future steps are. How do you think you're going to benefit from all of these experiences that you've been having? What would you really like to get involved in the future?
Oh, I would definitely like to pursue a portfolio GP career. So as I mentioned, I'll try and split my week between some time in clinical, continuous health policy side, and then on the side doing a bit of medical education. So I want to split my week. Yeah.
Yeah. Okay. Well, that's fantastic. Well, Devina, it's been a pleasure talking to you, and thanks for being on the podcast.
Thank you for having me.
Yeah. If you're listening to this message, it hopefully means that you've enjoyed this episode of the podcast. Thank you for listening. It's for listeners like you that I'm making this content, and it would be amazing to have your support. The ways that you can support this podcast are leaving positive reviews on social media and subscribing if you're listening to this on YouTube. The more listeners like you who subscribe, the more I'll be able to improve the podcast and make better content for you to listen to. So if you like where this podcast is heading, please consider becoming a subscriber. I'll see you in the next episode.